some point, most men will either be offered a prostate examination as part of general health screening, or it will be advised because of their age or some problem with urinating. Joining us this morning is Dr. Fred Nagel with the Baptist Health Medical Clinic in Maumelle to tell us if you are in need of a prostate exam. Good morning to you.
Good morning, Allison.
Thanks for coming in early this morning. Let's first off talk about what the test includes, because I would imagine that uneducation or the unknown might keep some men from even inquiring.
That's right. Let's start with the PSA test. That's what most people are familiar with. That stands for prostatic specific antigen, and that's a tumor marker that's excreted in excessive amounts in the prostate when you have cancer or inflammation or infection. The other part of the exam is the digital rectal exam, and that's when a gloved finger is inserted into the rectum. You palpate or feel the posterior lobe of the prostate for any abnormalities. Now, that's the part of the exam, excuse me, that causes the most trepidation and apprehension.
As you can imagine, yeah.
It's most important to do both of them because both together provide a much more powerful screening tool than just either alone.
Okay, makes sense. What can a prostate exam tell you? Once you get this, it can tell you, obviously, if you have cancer?
Well, indirectly. The PSA, if it's elevated absolutely beyond normal levels, or if there's a rapid rise even in normal levels, could indicate a problem and should warrant further evaluation, but doesn't diagnose it itself. The digital rectal exam, you're looking for three things: the size of the prostate exam, which could cause some urinary outflow problems, the texture of the prostate, if it has firm nodules or irregularities that could be a cancerous tumor, or tenderness that could indicate inflammation or infection due to prostatitis.
How does a man know when it's time to go and get that exam?
Well, currently the American Cancer Society recommends screening at the age of 50, and then yearly thereafter. If you are in a high-risk group, such as family history of prostate cancer or Afro-American, you should have it earlier, about the age of 40. And then finally, we probably stop screening around the age of 80, or if your life expectancy is less than 5 years.
Gotcha. Okay, so what can you tell men out there that are watching today to come in and get this simple test? Because again,
Well, what I would tell men is that prostate cancer is one of the most common cancers in men beyond middle age. So that's important right there. There are over 200,000 new cases each year, 30,000 deaths from prostate cancer each year. Unfortunately, there are no early screening signs, but if detected early, it can be treated and cured. And finally, I would just simply say the prostate exam is a simple test, just takes a couple of minutes with minimal discomfort. So what more could you want from a screening test that could save your life?
Absolutely. And if it does point to cancer, then what happens?
Well, then you will see a urologist, and he will most likely perform what's called a prostate biopsy. And that's where a sample piece of tissue from the prostate is examined under the microscope for cancerous cells. And then if you do have cancer, you have numerous treatment options that you should discuss frankly with your physician, because they can vary from watchful waiting to radiation therapy to hormone therapy or even surgery. And that can be based on your age, your medical condition, and the risks of those treatments.
And certainly a good relationship with your doctor is one of those things that makes this a little more easier probably to do. So,
that's right.
Dr. Fred Nagel, thanks so much for coming in this morning.